Hello, everybody. So I'm Sam Ducamp, and I am the CEO and founder and co-inventor of the technology that have generated Diamidex. So I'm very happy to be here with you today and to present Diamidex company and this investment opportunity. So today with me, we have Audrey Dumont, that is in charge of the R&D, David Blandin, that is in charge of the operation and the supply chain, and Didier Noël, that is in charge of the finance and the administration of the company. All together, we will be very happy to answer all your questions at the end of the webinar. So on the bottom right, you have a chat box where you could enter all your questions. If you have some issue during the webinar, you could also ask, our team to solve them. So this is also possible. So I have a list of housekeeping. I try to see if I make no mistake and I'm not forgetting something. But yes, please. So don't forget to ask all the questions at the end of the webinar. So let's start, and thank you again to be here with us today. So at Diamidex, we make the invisible visible faster to make our world safer. So we are a company that is dedicated to microbiological quality control analysis. So which means that we develop and distribute fast culture-based solutions that allow to enumerate earlier the microbes in order to deliver accurate and fast results for a large number of type of customer that have laboratory. So, sorry, I'm not used to the webinar, so I will be my best. So like Biorad, Thermo Fisher, bioMérieux, or Merck, like example, we are a microbiological testing solution manufacturer, which means that we develop solution and our main for microbiological analysis, and our main customer are laboratory. So there are two types of laboratory. There are the contract laboratory that perform analysis for third party, so like SGS or Eurofins or small laboratory like Wessling. And you have internal laboratory that are present in company that could be large company like Danone, Pepsi, Coca-Cola, Nestle, but also small companies that want to analyze the microbiological parameter in order to avoid human risk. So today, when you want to make microbiological quality control analysis, the main solution are based on culture. Culture method have been developed in the 19th century by Pasteur, and so far there are no change in the use of this solution. The main advantage of the solution is that it's a solution that is very accurate, and the main issue is the time to obtain result. You could have result after 1 day for some microbiological parameter, but sometimes it takes 2 weeks, 3 weeks, or 4 weeks. And this is a very important problem for everybody, because when you want to make good quality control analysis, time is key, and when you need to release your product and you need to wait a lot of time, it's a big issue for the industry. And when you have a water that is contaminated and that people start to drink it, you could contaminate people, and this is also important for the population. So it's the reason why today you have a lot of alternative methods that have been developed since more than 30 years. But almost all these solutions that are very rapid are not reliable to the culture method. And this is where Diamidex play in order to develop solutions that allow to combine the accuracy of the standard method and the rapidity of all these alternative methods. And the goal is always the same: save money for the business and save life, with a better control. So if we go from the beginning, when you have a sample and you want to identify the microbes that are present in this sample, you take your sample, you filter your sample on a Petri dish, which is a grow media. These microbes that are present, will start to multiply and divide and become, at the end of the day, after 1 week, 2 weeks, 3 weeks, visible by the eye of the technician. When you are at this stage, it's not finished, because after you need to make the identification of the microbe, which means that you have more manual steps that are needed to make the confirmation of the microbes that are potentially interesting for you. And after all this period, you obtain the result and you make the action that is correct based on the result that you obtain. At Diamidex, what we have done is that we have developed a solution that allows simultaneously to detect, identify, and enumerate the microbe of interest in one shot and in a stage where the object or where the microbes are not visible by eyes, because it's microcolony and not colony. So we do it with deep science, and I will explain you later. But at the end of the day, what we want is to have a solution that will become as simple as possible and at an affordable price. So for that, what we have done is we have combined 3 different technologies. We have combined an equipment that is based on optics and mechatronics, that is able to collect the signal present on the membrane at the end of the process of growth of the microcolony. But we combine it with specific labeling process that allow to tag specifically the microbe of interest, and this microbe of interest will become fluorescent, will become shiny. And by machine learning, we are able to make the difference between the right microbes, the one that we want to label, to detect, and all the other one. So when we combine machine learning, specific microbiological tagging, and optics, we generate MICA, which is a microcolony automatic counter. This technology is protected by 6 family patents today that are already granted. So we have a first equipment named MICA Advance that have been released in 2024, so it's very recent. Before that, between 2022 and 24, we have started to produce a prototype of the solution, and we have learned from our first customer in order to improve our system. So with this equipment, MICA Advance, we are able to enumerate several microbes. So today we have Legionella pneumophila and Alicyclobacillus, where we are able to reduce the time between 4 and 6, between 4 and 9 times faster. And we will have Pseudomonas aeruginosa by end of the year. And in June, we will have E. coli that will be able to be enumerated after 6 hours instead of 1 day. The beauty of the technology is that you use the same equipment, and based on a standard recurring model revenue, where the customer buy the consumable, the technician is able to perform the test depending on the parameter that he is interested by. And one equipment is able to perform 500 analyses per day, with a reduction of the labor time that is more than 4 times. In 2025, we have released a new equipment called MICA Highlight that is able to enumerate the total number of microbes present in a sample. And this is also an interesting parameter for microbiological laboratory. It's a global view of what is present in the sample. And we divide the time by 2 in this solution. So we address all market where you have filterable product. So mainly we are focused on water and beverage. We have the chance to have a worldwide partnership for the pharma product, with a major company, and I will explain you later, and the product will be released by end of the year. Indeed, we have a partnership, and I cannot disclose the name, for the total microbiological contamination on pharma market. And we work with this company during 4 years to develop for them a solution that will allow to enumerate the total number of microbes present in a sample coming from the pharma. They have the exclusivity of this technology and they pay for it more than 800K. And for the R&D, they pay us 1.6 million during these 4 years in order to develop the solution that will be produced by a third party. So this product will be released by end of the year, like I say, and we will have royalties of 5% every time that this partner will sell one equipment. We expect a recurring revenue of around 1 million euros per year in around 2030. And like I say, this solution will be released in the market by end of the year. And when the solution will be released, everybody will be aware about our partner. But from now, we are not allowed to communicate, unfortunately. So today, we have a network of distributors that have grown very rapidly. Last year, we obtained 8 partnerships with distributors that are focused on microbiological analysis. And after 1 year of promoting our solution, this number of distributors grew from 8 to 17, and our goal is to reach more than 30 distributors in 2027. And like you could see here, we are present not only in Europe, but also in Asia and in North of America. And this is very important for us to grow, as fast as possible with a really strong network of distributors. Today, we have 14 customers all around the world that are using our MICA advanced solution. So we have customers in South Africa, in Greece, in China, in Trinidad, in Senegal. I was last week, I think, in Pasteur Institute in Senegal, where I have installed MICA advanced Legionella there. I was before in Macau, to do the same. We have today 25 trial phases that are ongoing or just finished or programmed for 2025. And these 25 trial phases, if they are converted to customer, represent an annual recurring revenue of more than 5 million euros per year, which is very important for us. So here is just some information about the voice of customer of some of our customers. Dubai Central Laboratory is using our MICA advanced Legionella solution since more than 1 year and have published in Gulf News a nice article on our solution. And by consequence, we are now, we have a lot of negotiation and discussion in the Emirates, and we have we have sent more than 10 quotations in the Emirates for MICA advanced Legionella solution, and we expect to have 1 or 2 sales equipment in the coming 2 months. In Macau, BLC, Macau is using our solution since end of last year, and explain us that using our system is able to multiply by 5 the number of tests that is able to perform per day. So you could see the increase in productivity, In the same way, for Aliciclobacillus, we have a customer in Greece that explained us that using our solution, he was able to save more than 75,000 euros per year, which means that he reimbursed the equipment in less than 6 months. And we are very happy to have Coca-Cola on board that have certified our MICA advanced Aliciclobacillus solution, and the same for SGS for Legionella pneumophila. So just to summarize, the contract laboratory, what they are very interested by is the capability of the system to reduce the technical time, the labor time, which is very important for them, And in the meantime, we save money by all the other extra costs because we reduce the eating time, we reduce the number of petri dishes that are needed, etc., etc. For the end user, what they research is more something that is used by non-skilled people. And it's the beauty of the technology. A child of 6 years could use our solution because it's very, very simple. We are straight to the point with very low number of steps that can be done by everybody. So today we have a team, a marketing team, and a sales team. So until June 2024, I was the only person in charge of sales in the company, And since that, we recruit 2 more persons in the company that are involved in the sales pipeline. And we have a marketing team that is now composed by 3 persons. So we have a pipeline with more than 20,000 people, that receive information from us. And we have, like I said before, 25 evaluations that are programmed for 2025 today. So I just try to keep the time. So in 2024, we reached around 1 million euro of revenue. In 2024. In 2025, we expect to have 1.5 million euro of recurring revenue, and this will grow rapidly based on the fact that we are working on a recurring revenue. We install a base of equipment that generate recurring revenue every year by the fact that they need to use consumable to test, to make the analysis. And during these 2 next year, thanks to the fundraising, we will increase our sales team by 2 and the distributor network by 2. So one important point, and I will finish with that, is that in February of this year, we are on the radar of many of large number of companies all around the world, and this is just some example of companies that are discussing with us. Since about 2 years, But one of them, maybe not one that is listed here, but have knocked to the door, in February, and is very interested by what we are doing and see clearly the advantage of our technology. And we'll start an evaluation of some of our solution by end of June, which is for us a good sign that we will be, able to have a very nice exit strategy in the coming few years. So I let now, everybody present before the question and answer session. Audrey, if you want to start.
Yes, thank you, Sam. Hello, everybody. So I'm Audrey Dumont. I have a PhD in microbiology, and I've been working at Diamidex for over 10 years now. I am also co-inventor of the technology which is used by Diamidex. So today I'm in charge of the research and the development in Diamidex, and for the past 10 years, I have developed a rapid microorganism detection solution with a multidisciplinary team, which are competencies in optics, in artificial intelligence, and of course in microbiology. So in the R&D, we are doing innovation and product development, of course, but we play an important role in supporting sales and in evaluation, which are doing by customers, and in certification and in accreditation processes if labs need it. So I'm happy to answer to your question. Thank you.
Didier, you want to continue?
Okay, yeah. So I am Didier Noël. I am the head of finance and administration. So briefly, so I spent almost 20 years within Philips. I ended up as a general manager of a small division that I sold out beginning of the years 2000. I spent then several years in KPMG as a consultant in financing strategy management for startup and innovative SMEs. And then I spent also another 5 years within a technological transfer office named SAT Sud-Est. And this is where I met Sam, who was coming from the CNRS, public laboratories. And I actually made the first licensing agreement between the CNRS and Diamidex to transfer the technology invented by Sam. Okay. And then in 2017, I joined Diamidex, which was one of the most promising projects I had to manage in the TTO SAT Sud-Est.
David, if you want to finish.
Yes, thank you, Sam. So good afternoon, everybody. I am David, an industrial engineer being the operations director at Diamidex. To introduce me in few words, my background is industrial. I've been involved in the Diamidex adventure for 7 years now. Prior Diamidex, I have worked 20 years in international industrial companies like Caterpillar, Alstom, General Electric, for instance, based mainly in France, but with 2 years experience in Canada as well. I had several managing positions at that time, mainly in quality, but quality within operations functions like sourcing, manufacturing, or even project management. I had experience in including European scopes of responsibilities, meaning leading a team of people spread over Europe and building an organization, defining the standard processes to make everybody working together. Within Diamidex, being the operations director, operations mean within Diamidex the complete supply chain from the customer under entry until the order delivery, including sourcing, procurement, subcontracting, manufacturing, quality control and shipment, and the after sales, the technical support as well. And I'm ready to answer your question. Thank you.
Thank you, everybody. So we have a lot of questions, so I hope that we will be able to answer all of them. So I will start with the first one. Any Dutch customers? So this one is for me. So today we have a distributor in Netherlands that is named Da Vinci Solution Laboratory, and this distributor is very active in the region. And we have already made three evaluation thanks to his support, and one more evaluation is planned before end of the year. And now we are negotiating with this customer. Unfortunately, you can imagine that I will not be able to disclose the name. The last thing that I can say for this country is that we have the chance to be evaluated by the KWR on a national project for micro-advanced Legionella on wastewater. And you have some information online on the KWR page. Audrey, if you want to say something else on KWR.
No, we are in progress for the evaluation, but it's quite good for now.
Perfect. So one more question. Can your technology run automatically without an operator and in a remote testing station? Audrey, it's for you.
Yes. No, for now, this is the result, which is automatic. This is the last part of your analysis. The first part is quite the same you used to do in a lab. So it doesn't change really the workflow in a lab. This is why it's very easy to adapt the solution. But you need to do the first step of your analyze, put in incubation, and after you can take your membrane, put on the cassette, take in the equipment, and have the automatic results of the number of microorganisms you have on your membrane. But of course, you can, for Legionella pneumophila, for example, you can enumerate 14,000 microcolony on the same membrane. So it's the reason why it's automatic. So, but we think that we can do all the automatic equipment in few years.
Yes, it's planned, but it's on our project indeed to have a full station that will be fully automated. One more question. Are you profitable, or when do you expect to be profitable? Didier, you want to say something?
Yes, as communicated, so in the forecast, so we plan to be break-even in 2017. In 2027, sorry, 2027. This is when we expect to be break-even.
Yes, but maybe we will be pure SaaS before. We will see.
Hopefully.
We never know. One more question. Based on the current 800,000 of investor crowdfunding with just 14 days left, are you still expecting to reach the 2.5 million invested through investor? And if not, what will be the impact of that in terms of your runway, need for other financing and timeline? So if you want, I will take that, you know. So it's a very important question. So as it is indicating in investor, we have the commitment of PureTerra for until 2 million euros. So which means that our goal today is to reach 1 million euros with investor. And when we will reach this number, we will be online to this 2.5 million euros. So which means that we need 200,000 more before the end of the crowdfunding to be able to collect in total 2.5 million. I hope that my answer was very clear. Do you have competitor developing similar technology? Audrey, it's for you again.
Yes, thank you. Similar technology, not really, because there is some systems that take images to enumerate microorganisms and colonies, yes. But in our case, we have developed a system which is able to take more than 100 high-resolution images. So we have a very detailed and very precise images, and we are able to see very little thing on the membrane, so at the stage of microcolonies. And we are specific because we have patented molecules to label specifically the targeted microorganisms. So I hope it's answer to your question.
One more question. So you're saying PureTerra will invest the next tranche of 1.5 million, 1 million investment or investor is reached, correct? Yes, it's correct. What will happen if you don't get the money you're demanding? So it's the last question. And the next question. So I guess that based on my answer just before, we expect that it will not happen. On investor.com, you are advertising patented testing system. Which are the relevant patents? Didier, you want to say something? Or you want that I answer?
He's on mute.
Didier, you are on mute.
Yeah, what? Can you say it again? So it's which number?
Investor, you are advertising patented testing system. Which are the relevant patents? You prefer that I answer?
Oh, we have, yes, you can, yes. But we have a mix of microbiology patent, and AI. So, but you can explain further.
Yes. So we have in total 6 patents. 2 patents are the property of Diamidex. The one that is used on mica highlight and that have been licensed to this key partner is a property of Diamidex, and it's a new way to detect microbes based on light. The second patent that is a property of Diamidex is used for Alicyclobacillus detection, and the one that is used for Legionella is licensed from the CNRS, which is the French Research Center of Science, you know. And we have a lot of know-how linked to the machine learning system that we have developed. Do you pay royalties? Which percentage? Didier?
Take it. Okay.
Yes.
Yes, we on the 4 patents which have been licensed by CNRS through the TTO, yes, we are paying royalties at a level of 5%, but that is only for one microorganism. It's not for all of them. Obviously, on the patent we are owning ourselves, we are not paying any royalties.
And this microbe is for Legionella pneumophila. So for the solution that is Legionella pneumophila, we are paying royalties. For all the other one, we are not paying royalties. You say the market will grow from 6 billion to 12 billion. Where is this based on? It's a market study that are available on the net, you know. So I will be able, if you want, to send you the information. Okay, I continue to the question. Oh, what's the difference between your technology and PCR-based technology? Audrey, it's for you.
Yes, the big difference between the PCR and our technology is the fact that we are based on the culture method as standard methods, and the unit used for the result is the same as standard method. So it's very easy to adopt and implement in a laboratory. This is
and the big difference, sorry, in between. Sorry, Audrey, please.
No, go, Sam, if you want to add something.
So, yes, on PCR, PCR is not able to make the difference between culturable microbes and non-culturable microbes. So when you compare PCR result and our technology and the standard method, we are much more accurate than the PCR on the enumeration, because PCR generates result on genome unit and not on colony forming unit. And this has been said not only by us, but also by our customers. I'm just continuing to, because there are a lot of questions, so I need to scroll and see if I'm not missing one. Sorry, I continue. Where are the device and consumable manufacturers? It's for you, David.
Yes, thank you, Sam. Both equipments and